Welcome to my YouTube channel. In this video, we will talk about stroke. So before going into the video, make sure to hit the like, comment, and subscribe button. What is a stroke? A stroke is a life-threatening condition that happens when part of your brain doesn't have enough blood flow. This most commonly happens because of a blocked artery or bleeding in your brain. Without a steady supply of blood, the brain cells in that area start to die from a lack of oxygen. Important: a stroke is a life-threatening emergency condition where every second counts. If you or someone with you has symptoms of a stroke, immediately call 911 or your local emergency services number. The quicker stroke is treated, the more likely you'll recover without disability. To recognize the warning signs of a stroke, remember to think: be fast. 1. Be watchful for a sudden loss of balance. 2. Look out for sudden loss of vision in one or both eyes. 2. Are they experiencing double vision? 3. Ask the person to smile. 3. Look for a droop on one or both sides of their face, which is a sign of muscle weakness or paralysis. 4. A person having a stroke often has muscle weakness on one side. 4. Ask them to raise their arms. 4. If they have one-sided weakness and didn't have it before, one arm will stay higher while the other will sag and drop downward. 5. Strokes often cause a person to lose their ability to speak. 5. They might slur their speech or have trouble choosing the right words. 6. Tea time is critical, so don't wait to get help. If possible, look at your watch or a clock and remember when symptoms start. 6. Telling a healthcare provider when symptoms started can help the provider know what treatment options are best for you. How common is a stroke? Strokes are very common. Worldwide, strokes rank second among the top causes of death. In the United States, stroke is the 5th cause of death. Strokes are also a leading cause of disability worldwide. How does a stroke affect my body? Strokes are to your brain what a heart attack is to your heart. When you have a stroke, part of your brain loses its blood supply, which keeps that brain area from getting oxygen. Without oxygen, the affected brain cells become oxygen-starved and stop working properly. If your brain cells go too long without oxygen, they'll die. If enough brain cells in an area die, the damage becomes permanent, and you may lose the abilities that area once controlled. However, restoring blood flow may prevent that kind of damage or at least limit how severe it is. That's why time is critical in treating a stroke. What are the types of stroke? There are two main ways that strokes can happen: ischemia and hemorrhage. Ischemic stroke. Ischemia, pronounced ischemia, is when cells don't get enough blood flow to supply them with oxygen. This usually happens because something blocks blood vessels in your brain, cutting off blood flow. Ischemic strokes are the most common and account for about 80% of all strokes. Ischemic strokes usually happen in one of the following ways. 1. Formation of a clot in your brain, thrombosis. 2. A fragment of a clot that formed elsewhere in your body that breaks free and travels through your blood vessels until it gets stuck in your brain, embolism. 3. Small vessel blockage, lacunar stroke, which can happen when you have long-term, untreated high blood pressure, hypertension, high cholesterol, hyperlipidemia, or high blood sugar, type 2 diabetes. 4. Unknown reasons. These are cryptogenic strokes. The word cryptogenic means hidden origin. Hemorrhagic stroke. Hemorrhagic, pronounced hem or ajic, strokes cause bleeding in or around your brain. This happens in one of two ways. 1. Bleeding inside of your brain, intracerebral. 1. This happens when a blood vessel inside of your brain tears or breaks open, causing bleeding that puts pressure on the surrounding brain tissue. 2. Bleeding into the subarachnoid space, the space between your brain and its outer covering. 2. The arachnoid membrane, a thin layer of tissue with a spiderweb-like pattern on it, surrounds your brain. 2. The space between it and your brain is the subarachnoid space. Sub means under. 2. Damage to blood vessels that pass through the arachnoid membrane can cause a subarachnoid hemorrhage, which is bleeding into the subarachnoid space, putting pressure on the brain tissue underneath. Symptoms and causes. An easy way to remember the symptoms of a stroke is the word fast. That word helps you remember key symptoms related to the face, arms, speech, and that minimizing the time it takes to receive treatment is critical. What are the symptoms of a stroke? The symptoms of stroke can involve one or more of the following. 1. One-sided weakness or paralysis. 2. aphasia, difficulty with or loss of speaking ability. 3. Slurred or garbled speaking, dysarthria. 4. Loss of muscle control on one side of your face. 5. Sudden loss, either partial or total, of one or more senses: vision, hearing, smell, taste and touch. 6. Blurred or double vision, diplopia. 7. Loss of coordination or clumsiness, ataxia. 8. Dizziness or vertigo. 9. Nausea and vomiting. 10. Neck stiffness. 11. Emotional instability and personality changes. 12. Confusion or agitation. 13. Seizures. 14. Memory loss, amnesia. 15. Headaches, usually sudden and severe. 16. Passing out or fainting. 17. Coma. Transient ischemic attack, TIA. A transient ischemic attack, TIA, sometimes called a mini-stroke, is like a stroke, but the effects are temporary. These are often warning signs that a person has a very high risk of having a true stroke in the near future. Because of that, a person who has a TIA needs emergency medical care as soon as possible. What causes a stroke? Ischemic strokes and hemorrhagic strokes can happen for many reasons. Ischemic strokes usually happen because of blood clots. These can happen for various reasons, such as 1. Atherosclerosis. 2. Clotting disorders. 3. Atrial fibrillation, especially when it happens due to sleep apnea. 4. Heart defects, atrial septal defect or ventricular septal defect. 5. Microvascular ischemic disease, which can block smaller blood vessels in your brain. Hemorrhagic strokes can happen for several reasons also, including 1. High blood pressure, especially when you have it for a long time, when it's very high, or both. 2. Brain aneurysms can sometimes lead to hemorrhagic strokes. 3. Brain tumors, including cancer. 4. Diseases that weaken or cause unusual changes in blood vessels in your brain, such as moyamoya disease. Diagnosis and tests. A healthcare provider can diagnose a stroke using a combination of a neurological examination, diagnostic imaging and other tests. The most common tests that happen when a healthcare provider suspects a stroke include 1. Computerized tomography, CORT scan. 2. Lab blood tests, looking for signs of infections or heart damage, checking clotting ability and blood sugar levels, testing how well kidneys and liver function, etc. 3. Electrocardiogram, abbreviated ECG or EKG, to make sure that a heart issue isn't the source of the problem. 4. Magnetic resonance imaging, MRI, scans. 5. Electroencephalogram, EEG, though less common, can rule out seizures or related problems. Management and treatment. Treating a stroke depends on many different factors. The most important factor in determining treatment is what kind of stroke a person has. 1. Ischemic. With ischemic strokes, the top priority is restoring circulation to affected brain areas. 1. If this happens fast enough, it's sometimes possible to prevent permanent damage or at least limit a stroke severity. 1. Restoring circulation usually involves a certain medication type called thrombolytics, but may also involve a catheterization procedure. 2. Hemorrhagic. With hemorrhagic strokes, treatment depends on the location and severity of the bleeding. 2. Reducing blood pressure is often the top priority because this will reduce the amount of bleeding and keep it from getting worse. 2. Another treatment option is to improve clotting so the bleeding will stop. 2. Surgery is sometimes necessary to relieve pressure on your brain from accumulated blood. Prevention. How can I reduce my risk of having a stroke or prevent them entirely? There are many things you can do to reduce your risk of having a stroke. While this doesn't mean you can prevent a stroke, it can lower your risk. Actions you can take include 1. Improve your lifestyle. 1. Eating a healthy diet and adding exercise to your daily routine can improve your health. Avoid risky lifestyle choices or make changes to your behaviors. Smoking and tobacco use, including vaping, recreational drug use or prescription drug misuse, and alcohol misuse can all increase your risk of having a stroke. Manage your health conditions and risk factors. There are several conditions, such as obesity, abnormal heart rhythms, sleep apnea, high blood pressure, type 2 diabetes or high cholesterol, which can increase your risk of having an ischemic stroke. Thanks for watching the video. I hope you like it. If you really do, don't forget to hit the like, comment, and subscribe button.